Hey, welcome to Adult and Child's first healthcare clinic. We are on Ohio Street, and I am not a videographer, so I apologize ahead of time for the video. As you can see, we are in the lobby. People will walk in from this entrance. There's two sections for check-in in the business office, and as we walk back towards the clinical space, you will see two checkout stations. Public bathroom, ADA accessible, and we'll walk back here past the registration office, benefits navigator type, into the clinic space. You'll see to the left here we have a series of 4 offices designed to be for psychiatry, addictions, and therapy. All of them are very similar. You'll notice possibly that we added a lot of transoms up top to really push some of that natural light through. Off the nurses station, we have a secondary seating area, keeping in mind some of the populations we assume we will be treating. We thought it'd be good to have a little space close to the nurses station that's not in the general lobby, in case people need that to be more comfortable. Comfort is one thing that we really put at the forefront of our planning. This is one of the 9 patient rooms. As you'll see, we have a kind of a workstation for the doc. This will house the EMR, the computer. We'll be able to share that information with the patient. And it's really set up so that the doc and the provider never have to really turn their back to the patient, so we can really promote strong patient interaction. One of the big features we have is, rather than weighing people and getting their height and blood pressure and all of that out in the main room that many physicians' offices do practice, we decided to do all of that in the room. So a patient will be moved only once from the lobby and then roomed. There is a digital scale, and then these really sweet vitals show blood pressure up here. They show pulse rate, oxygen level, weight, height, calculates your BMI, and does temperature, respiratory rate, and then a pain score. We'll be measuring pain score automatically for everybody who enters. And then with the push of a button, this data will dump into our electronic record, health record automatically. So that'll help with a lot of data management, reduce on errors, that kind of thing. So as I mentioned, 9 exam rooms. 8 of them are typical exam rooms. 1 is for bariatric patients. This is our hoteling space for docs. Typical. Down here is the exam room. The staff lounge. These boxes are leftover pieces and parts that we will be moving. As I go down the hallway here, wanted to touch base on the fact that this clinic will be integrated with behavioral health, addictions, and primary care. While the behavioral health offices are separate, the real intent is to develop a function for warm handoffs, so that initial interactions will be in the patient exam rooms that I just showed you. This is Adult and Child's first CLIA-waived laboratory, and our first ever autoclave, which is used to sterilize instruments. This room, as I said, will be our CLIA waiver laboratory. We'll be able to test point of care testing for A1C, blood levels, addictions, UDIs, urine drug analysis. There's a pass-through to a bathroom next door that's set up perfectly for urine drug tests. Bathroom. So this is the clinic. We really wanted to put some high-end finishes in it to make people proud of it to work here, but also to come here. So as people check out, they'll walk past the nurses station and back out to the checkout and to the lobby. Thank you.